Committee on Insurance and Financial Services shall come to order. Mr. Clerk, will you please call the roll to establish a quorum?
Chair Carter.
Present.
Representatives McFall.
Here.
Breen.
Present.
Rogers.
Here.
Scott. Young.
Here.
Fitzgerald.
Here.
Grant.
Here.
Cernglew.
Here.
Song. Harris.
Here.
Markkinen.
Here.
Bazat. Aragona. Bruck.
Present.
Neyer.
Here.
Smith.
Present.
Madam Chair, you have a quorum.
Thank you. Now we need a motion to adopt the minutes from November 14th, 2024 as printed. Rep. Breen moves to adopt the minutes as printing. Hearing no objection, the minutes are adopted as printed. Committee members and guests, before we jump into our agenda, I wanted to take a moment to thank you all for the wonderful 2 years. This committee has reported around 60 bills, many in a bipartisan vote. We have worked together to take on what is arguably one of the most complicated policy issues facing our state, insurance and financial services. As a little thank you to all of you from me, I have brought with me some delicious, aren't they delicious?
Amazing.
Okay, Avon donuts from exclusively from Pontiac. So please enjoy at your leisure. I would also like to highlight today, we have a special viewer in our committee, Alexis Glenn, a postdoctoral fellow at Bristol Myers Squibb, will be viewing this committee as part of her studies. Welcome, Alexis. Can you please stand up so everybody can see you? Okay, the first item on our agenda is testimony only on Senate Bill 378, introduced by Senator Singh. As an insurance producer, I understand the importance of continuing education credits. Producers need these credits to be able to maintain their licensure. This bill will add much needed warranted flexibility for the ways in which producers can accumulate their credits. With this bill, for example, the National Council of Insurance Legislators, NCOIL, would be able to qualify for some of these continuing credits. And colleagues, I've always highly suggested to you to join me at NCOIL. The organization is a wonderful bipartisan group of elected leaders who truly care about making good policy in this country. But I digress. Now to the bill. Here to speak to the bill is Senator Singh and Chuck. He is here. Hi, Senator.
Hey, how are you?
Senator Singh and Chuck May, Government Relations of the National Association of Insurance and Financial Advisors. You're already here. The floor is yours.
Thank you very much, Madam Chair and members of the committee. I'm pleased to be here. This is actually, I think, an item that you've had some opportunity to discuss in the past, and look forward to bringing it back up for the group. This issue was brought to me last spring during a meeting with some of my constituents who represent the National Association of Insurance and Financial Advisors. This obviously is one of their top priorities. I've been pleased to have Chuck May here, who will talk a little bit more about this bill. I want to thank DIFS. The department has been great to work with. I know this is something that they think will be helpful to the industry. Current law requires 24 hours of continuing education over a 2-year licensing term for insurance agents. This bill is very simple. It will allow for up to 4 of those continuing education hours to be achieved through the engagement with the federal chapter of the National Association of Insurance and Financial Advisors. I always think, many of you have been involved with different industries and associations of those industries, having that engagement and that involvement is, I think, an incredible learning experience. It's a great opportunity to give back to your industry, and this would acknowledge that and allow those 4 hours to be part of that continuing education. And so I won't speak much. I think the chair spoke to this concept very well as well. I'll turn it over to Chuck. It did pass out of the Senate chamber 37-1 in a great bipartisan fashion, and so I hopefully that you will be able to take this up and do the same on your end. So I'll turn it over to Chuck, and then be pleased to answer any questions, Madam Chair and members of the committee.
Good morning. Nice to see you again. Thank you, Chair Carter and committee members, for allowing me to testify on Senate Bill 378. Looking at your agenda this morning, I'm going to keep it very short. My name is Chuck May, and I'm the Government Affairs Chair for the National Association of Insurance and Financial Advisors, better known as NAFA Michigan. I'm also past president of NAFA Michigan. In general, professional insurance associations or associations of any profession like NAFA Michigan promote high standards of ethical conduct among their members and provide educational programs and professional development opportunities to association members. We believe that the state proposals to allow advisors to receive some CE credit for association participation could encourage financial advisors to join and participate in their professional associations. In general, ultimately, this benefits consumers by providing access to better qualified advisors. Thank you.
Okay, are there any questions from the committee? Okay, hearing none, we're going to read in some cards.
Thank you so much.
You're so welcome. Thank you. Speak in supporting the bill, Alex Hausman of the Big I. Not wishing to speak and neutral on the bill is Joseph Sullivan from the Department of Financial Services. Not wishing to speak and supporting the bill is Ryan Bertleg, National Association of Insurance and Benefit Professionals, Michigan Chapter. Okay. Thank you for that. All right. Next on our agenda is a testimony only on Senate Bill 495, introduced by Senator Lauwers. Here to speak to the bill is Senator Lauwers, and joining via Zoom, Allison Koppel, the Chief Executive Officer of the American Fraternal Alliance. Please come forward as you have and unmute for Allison. Please begin when you're ready.
All right. Well, good morning. Thank you, Madam Chair and members of the committee. Thanks for taking up Senate Bill 495. It's a reintroduction of Senate Bill 712 from 2022. And as the good chair lady said, with me today is Allison Koppel, from the President and CEO of American Fraternal Alliance. Senate Bill 495 seeks to improve the solvency of fraternal benefit societies and protect members in the event of a loss or insolvency. The societies are able to offer various insurance products like life insurance and annuities to their members. Senate Bill 495 protects individuals from potential loss should the fraternal insurer reach a regulatory insolvency trigger. It outlines the process for and when rehabilitation or liquidation and subsequent transfer must occur. The fraternal societies across Michigan use the proceeds from their financial services to really help our communities. There are 41 different fraternal benefit societies here in Michigan with over 315,000 members. They contribute over $23 million to our communities per year, and over 2 million volunteer hours are given per year by fraternal members across Michigan. I'd now like to turn it over to Allison, Madam Chair, and she can address any other questions you yourself or members might have.
Good morning. I'm Allison Koppel, the CEO of the American Fraternal Alliance. And thank you so much for allowing us to show our support for Senate Bill 495. As was mentioned before, we represent over 50 fraternal benefit societies, which are a special type of life insurer and annuity provider across the United States. And this is really pro-consumer legislation to protect individuals from potential loss should a fraternal insurer become impaired. Excuse me. The bill allows the department additional tools if a fraternal crosses the authorized control level RBC. It stipulates a fraternal must inform the department if it has plans to assess its members, and then the department can then disapprove of such an assessment. It allows for governance structures of an impaired fraternal to be circumvented to allow the transfer of certificates to another fraternal or to another type of insurance carrier. And it streamlines the liquidation process to minimize losses to certificate holders. This pro-consumer legislation is supported by the domiciled societies in your state, and it strengthens the entire fraternal insurance sector. thank you very much for allowing me to provide our support for SB 495.
Thank you very much, both of you, for your testimony. Members, do you have any questions?
Brock does.
Representative Brock.
Thank you, Madam Chair. Thank you, Senator, for being here. Just one question. Can you give me an example of what this would exactly fix, or an example where this would come into play in the past, where this, I guess the issue this is solving, I guess, is what I'm not in a fraternal order, and when I think of fraternal order, I think of, like I don't know, the Elks or something, but I didn't know they're quite involved in insurance and that, but just,
Nope,
if you
you're
don't mind,
right,
thank you.
Representative. I'll speak very briefly too, and I'll turn it over to Allison. But if you think of Gleaner Life Insurance Society, Women's Life Insurance, those are examples. And it's really about insolvency. If they were to approach a point of insolvency and hit this sets certain triggers to make sure that that's caught early enough that it can be basically reorganized or bought out by a different society to protect the investments. Allison, you want to clarify that?
Sure, you nailed it. Our members are insurance companies. So yes, they've got some similarities to the ones that you mentioned, but they are insurance carriers. Most of them have been around for over 100 years, and some of them have some very old archaic governance structures. So part of one of those things that I mentioned is circumventing a certain governance structure to allow for a fraternal that has only reached that very, insolvent stage to merge with another fraternal, because some of those governance structures prevent that or don't allow for it for years until a convention happens. So that's just one example of what this legislation does.
And just that one follow-up question, Madam, are there examples of where this did happen and it affected all these stakeholders with these organizations? And
Sure. So there's legislation that has passed in 5 other states over the past, 6 years, but it has never been used. It's more of a forward-looking protection piece of legislation. It has not been used yet, I'm happy to say.
Are there any other questions, committee? Hearing none, we have, not wishing to speak and supporting the bill, Joseph Sullivan, Department of Insurance and Financial Services. Okay, the next items on our agenda today are votes. Thank you so much for coming, Senator. Okay. Next item on our agenda is votes on House Bills 6099 through 6104 and 6106, the captives insurance package. We heard testimony on these bills on November 14th. So, I need a motion to report House Bill 6099 with recommendation. Representative Fitzgerald moves to report. Clerk, would you please call the roll?
On the motion to report House Bill 6099, Chair Carter.
Yes.
Representatives McFall.
Yes.
Breen.
Yes.
Rogers.
Yes.
Scott.
Yes.
Harris. Young. Fitzgerald.
Yes.
Grant.
Yes.
Cernglue.
Yes.
Song.
Yes.
Harris.
Yes.
Markkinen.
Yes.
Bazad. Aragona. Bruck.
Yay.
Neyer.
Yes.
Smith.
Yes.
Madam Chair, you have 16 yeas, no nay, no pass. The motion prevails.
Thank you. House Bill 6099 is reported with recommendation. Next, I need a motion to report House Bill 6100 with recommendation. Rep. Breen moves to report. Mr. Clerk, would you please call the roll?
On the motion to report House Bill 6100, Chair Carter.
Yes.
Representatives McFall.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Cernglue.
Yes.
Song.
Yes.
Harris.
Yes.
Markkinen.
Yes.
Bazad. Aragona. Bruck.
Yay.
Neyer.
Yes.
Smith.
Yes.
Madam Chair, you have 15 yeas, no nays, no pass. The motion prevails.
Thank you. House Bill 6100 is reported with recommendation. Next, I need a motion to report House Bill 6101 with recommendation. Representative Glue, I saw you nod. Okay. Rep. Senator moves to report. Mr. Clerk, would you please call the roll?
On the motion to report House Bill 6101, Chair Carter.
Yes.
Representatives McFall.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Cerniglu.
Yes.
Song.
Yes.
Harris.
Yes.
Markkinen.
Yes.
Bazat. Aragona. Bruck.
Yay.
Neyer.
Yes.
Smith.
Yes.
Madam Chair, 15 yeas, no nays, no pass. The motion prevails.
Thank you. House Bill 6101 is reported with recommendation. Next, I need a motion to report House Bill 6102 with recommendation. Rep. Breen, did you? Okay, Rep. Breen moves to report. Mr. Clerk, can you please call the roll?
On the motion to report House Bill 6102, Chair Carter.
Yes.
Representatives McFall.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Cerniglu.
Yes.
Song.
Yes.
Harris.
Yes.
Markkinen.
Yes.
Bazat. Aragona. Bruck.
Yay.
Neyer.
Yes.
Smith. Madam Chair, 15 yeas, no nays, no pass. The motion prevails.
Thank you. House Bill 6102 is reported with recommendation. Next, I need a motion to report House Bill 6103 with recommendation. Rep. Young moves to report. Mr. Clerk, can you call the roll, please?
On the motion to report House Bill 6103, Chair Carter.
Yes.
Representatives McFall.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Cerniglu.
Yes.
Song.
Yes.
Harris.
Yes.
Markkinen.
Yes.
Bazat. Aragona. Bruck.
Yay.
Neyer.
Yes.
Smith.
Yes.
Madam Chair, you have 15 yeas, no nays, no pass. The motion prevails.
Thank you. House Bill 6103 is reported with recommendation. Next, I need a motion to report House Bill 6104 with recommendation. Rep. Zong, I saw you move. Okay, Rep. Zong moves to report. Mr. Clerk, can you please call the roll?
On the motion to report House Bill 6104, Chair Carter.
Yes.
Representatives McFall.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Cerniglu.
Yes.
Song.
Yes.
Harris.
Yes.
Markkinen.
Yes.
Bazat. Aragona. Bruck.
Yay.
Neyer.
Yes.
Smith.
Yes.
Madam Chair, you have 15 yeas, no nays, no pass. The motion prevails.
Thank you very much. Next, I need a motion to report House Bill 6106 with recommendation. Rep. Scott moves to report. Mr. Clerk, would you please call the roll?
On the motion to report House Bill 6106, Chair Carter.
Yes.
Representatives McFall.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Cerniglu.
Yes.
Song.
Yes.
Harris.
Yes.
Markkinen.
Yes.
Bazat. Aragona. Bruck.
Yay.
Neyer.
Yes.
Smith.
Yes.
Madam Chair, 15 yeas, no nays, no pass. The motion prevails.
Thank you very much. House Bill 6106 is reported with recommendation. The next item on our agenda is testimony only on House Bill 5340, introduced by Minority Vice Chair McFall. Here to speak on the bill is Minority Vice Chair McFall. Is it Majority Vice Chair McFall. I'm sorry, correction please. Majority Vice Chair McFall.
That's the next year.
Okay. I did that one to myself, okay? Anyway, and Anthony Williams of Corktown Health, and joining us virtually is Kelly Doyle from Care Sexual Wellness Services, time independent, oops, that's something he should put in there. Please come forward, the floor is yours.
Thank you, Madam Chair, and thank you, committee, for hearing my testimony today. I will speak today on HB 5340, which would codify the preventative care portion of the Affordable Cares Act for coverage of PrEP. Pre-exposure prophylaxis, otherwise known as PrEP, is a preventative medication that helps stop the spread of HIV. PrEP has saved countless lives and prevented the spread of HIV since it became an FDA-approved drug in 2012. This is a disease that has potential to affect everyone, and it can be costly to patients and insurance companies when someone is diagnosed with HIV. Despite common belief that HIV only impacts the LGBTQ community, heterosexual couples are at risk for contracting HIV too. HIV.gov states that in 2022, heterosexual contact made up 22% of the 37,981 HIV diagnoses in the U.S. and its territories. Now that you know what PrEP does, you may be wondering what HB 5430 does and why it is necessary. The Affordable Care Act requires that most private insurance plans cover recommended preventative care services without cost sharing, including access to PrEP. There have been legal challenges to the ACA since its adoption, including the ongoing Braidwood Management versus Becerra case, which is a direct attack on preventative care coverage, including and specifically PrEP. With my bill, the federal ACA and its preventative care protections will be enshrined in Michigan law. This is consistent with the other legislation we have passed this session. This means that Michiganders no longer have to live in fear that their life-saving medication could be stripped away from them overnight by a federal court across the country. PrEP is a preventative drug that allows people of all backgrounds and sexual identities to live without fear of contracting HIV. There has been and will continue to be challenges to the ACA and its preventative care requirements through the court system. Passing HB 5430 will ensure that Michiganders are protected, regardless of any changes made at the federal level. Thank you again, Madam Chair and Committee, for hearing my testimony. I am happy to answer any questions, but I also have Anthony here who will be able to speak as well.
Good morning, Madam Chair, Representative McFall, and the members of the committee. My name is Anthony Williams. I'm the president and CEO of Corktown Health, Michigan's first nonprofit community-based medical home focused on meeting the healthcare needs of the LGBTQ+ community. I'm here today to express our strong support for House Bill 5340 and to urge this committee to move it forward. House Bill 5340 is a vital step in combating the ongoing HIV epidemic. By requiring health insurers to provide coverage without cost sharing for PrEP and associated clinical services, including HIV testing and provider visits. This measure is essential for ensuring access to preventative care that has been proven to successfully reduce the risk of HIV transmission. At Corktown Health, we see firsthand how access to PrEP can change lives. PrEP reduces the risk of contracting HIV by up to 99% when used correctly. Yet many Michiganders can't afford it due to the cost of medications, office visits, or lab work. By eliminating these barriers, this bill will make prevention accessible to more people, especially those living in marginalized communities who are disproportionately affected by HIV. The impact of this legislation extends beyond the individual health outcomes. It represents sound public policy. For every new HIV infection prevented, the state saves approximately $400,000 in lifetime medical costs. Expanding access to PrEP is not only a life-saving intervention, but also a cost-effective strategy for our healthcare system. Critically, this bill also guarantees that insurers cannot impose unnecessary restrictions such as prior authorizations or step therapy for at least one FDA-approved PrEP option. These protections are vital to ensure timely access to care. I can't overemphasize this point. Corktown Health has worked with patients who were ideal candidates for PrEP, but could not access the care they needed in a timely manner due to these administrative burdens. And we are aware of at least 2 individuals who subsequently became HIV positive. Passing this legislation will reaffirm Michigan's commitment to ending the HIV epidemic and addressing health disparities. It sends a powerful message that prevention is a priority and that we value equitable access to life-saving health care for all residents. So on behalf of Corktown Health and the communities we serve, I urge you to support House Bill 5340. Thank you so much for your leadership on this issue. I'm happy to answer any questions you might have.
Thank you very much for your testimony. We do have one other person who wants to testify, and it's Dr. Paul Benson. He's on Zoom.
Good morning, everyone. I'm sorry I was on mute to start out with. Let me just tell you a little bit about myself. I've been in practice since 1980 at the beginning of the HIV epidemic. I'm managing about 3,000 people living with AIDS and probably about 1,000 people on PrEP. I don't think it's a surprise to anybody listening that our healthcare system could stand a lot of improvement and that we really need to treat everybody equally. And it's much easier said than done. And I've always lived with the definition of quality of anything, and quality is everything except the price and the cost. And PrEP for HIV prevention should be treated like any other preventable disease. Vaccination programs, colon cancer screening, prostate cancer screening, breast cancer screening. This really is no different. We've made progress with insurance companies paying for preventive services for these other diseases, but it's kind of lacking in the HIV world. I'd like to think it's not stigma related, but I'm sure that it partially is. A doctor needs to be free to make shared decisions with their patients. And it's, again, probably no surprise, the insurance companies seem to get in the way and hinder that process. And a lot of people are frustrated about it. And I don't know what yesterday's events that happened in New York have anything to do with this or not, but there's just a lot of frustration, and there's a lot of frustration in the LGBTQ community. And we need to do this. The eradication and cure for AIDS is not going to be easy, and it's not going to be just take a pill and it's over with. If we want to eradicate HIV prevention is just a critical part of that. That's the only way we're going to do it. There's 40,000 cases of new HIV cases in the United States each year. There's 1.2 million people living with HIV. And the scary thing to me, I guess, the double-edged sword, it's good and bad. Our therapy for treating HIV is real good right now, and people are living longer, and that's a great thing. But the number of HIV individuals that are living are increasing the total pool of individuals that can spread the disease to others. Thank goodness that they're living longer, but there's more people out there that could spread it to other individuals. And we got to get a handle on this. And the only way we can really get a handle on it is to educate people and make PrEP easy to get. And right now, it's not easy to get. We got to jump through hoops. It's very frustrating as a provider. Many patients come in wanting to go on PrEP, and by the time we get the insurance struggles taken care of, they're lost to care. They don't come back. So we've really got to make this process easy, because we want, the prevention to be part of the cure, to be part of the eradication. So it's really necessary that this bill be passed, and probably a bill to improve education to medical providers in the community, because clinics like mine in Corktown and other ones that specialize in HIV care, we're doing it, and we're bringing up and taking sexual histories and identifying the people that are at risk for HIV. But it's really unfortunate that most healthcare facilities, whether they be internal medicine, family medicine, gynecologists, they sweep the whole issue of human sexuality under the rug. It just takes time, and they don't want to talk about it, and that's contributing to this epidemic as well. I'll be happy. I'm going to stop here because I don't want to go on and on. We all got business and other things to do, but I'll be happy to take any questions if you have any.
Okay, thank you very much for your testimony. We do have one other person who wants to testify, and that's Kelly Doyle from the Care Sexual Wellness Services. Kelly? Okay, she's on mute. You're on mute.
Got it. Thank you so much.
Okay.
Let me get to my notes here then. Thank you for having me. My name is Kelly Doyle. I'm the CEO of CARES of Southwest Michigan and the chair of the HIV/AIDS Alliance of Michigan. We provide PrEP services to the state of Michigan, and we also have a clinic that provides LGBTQ and HIV care. I'm here to discuss the importance and why access to PrEP and the recommended clinical services are necessary for coverage. I'll make sure not to repeat what others have said. If PrEP is taken correctly, it can be 99% effective. And just for you to know, like, why is this important? Why is the process of PrEP? What is it? Why is it important? Somebody wants to go on PrEP, they call their provider, get an appointment. They have to complete labs first. These labs would test them for their kidney function and also their, if they have any STIs. And then they would treat those and then meet with the doctor and discuss those health concerns, answer questions, and prescribe the medication. PrEP is currently in pill or injection form. You know, these medications can be very toxic, so it's really important that we have doctors that are monitoring the health of people that are trying to protect themselves from becoming infected with HIV. PrEP is an effective tool in our goal to end the epidemic of HIV in our lifetime. It was that end the epidemic plan was launched by the Trump administration in 2019. And we cannot do this if we don't have the safe healthcare monitoring for the use of PrEP. We can't allow employers to create religious exemptions for their employees. That would be like saying, could companies that were run by Scientologists would be able to determine if they could provide psychotropic medications. This bill would codify the ACA Preventative Task Force recommendation. And it's important because of these recent court cases that challenge these preventative care requirements. This bill does not change what is required of insurance providers already. This is a federal mandate. The bill would protect Michiganders from being affected by a federal court across the country overreaching on our rights to equitable healthcare access. We have to protect the necessary healthcare services in order for us to end the epidemic of HIV. And just another note is, and I believe CEO Williams discussed this, was this is more cost effective to have somebody on PrEP than to be HIV positive. And I think the other thing is to note that we have concerns about court cases from like insurance companies themselves. As we heard yesterday, in November, Anthem Blue Cross Blue Shield plans in states have unilaterally declared it will no longer pay for anesthesia care if the surgery or procedure goes beyond an arbitrary time limit, regardless of how long the surgical procedure takes. We must let science and healthcare providers dictate our required care and not insurance companies. And as you might have saw on the bridge today or recently in the last couple of days, MDHHS launched an aggressive plan to reduce HIV infections by 90% by 2030. We could only do this if we have access to all of our toolbox. And PrEP services is one of those things that we have seen decrease new infections in the past 5 years. Thank you for your time.
Thank you all for your testimonies, very informative. Now I'm going to open up to the committee. Committee, are there any questions? Rep. Young.
Thank you, Madam Chair. Thank you all for your testimony. I have a couple of questions, if that's okay, Madam Chair. So my first question is, this is codifying what currently exists. I've heard that several times. But I also heard Dr. Paul Benson say what currently exists is kind of a hot mess trying to access. So we're codifying what's problematic already.
No, we're not codifying what's problematic. I think his phrasing.
I mean,
yeah, because he was expanding on other things that are issues. This is actually functioning very well currently under the ACA preventative care. This just codifies that. There is more work always to do, and I think that's what he was referring to.
Okay, I just wanted to be clear.
Yes. No.
And then second, there was a mention of a possible substitute. I don't see that here. It says
We're still working on
Okay, you're
that.
still
We're
working on
working with stakeholders, so we're still working that out.
Okay,
Yeah.
all right, thank you.
Thank you. Representative Rogers.
Thank you, and I have to give a shout out to my hometown team. So thank you to Kelly Doyle for testifying from Kalamazoo. I have a question about, can you elaborate a little bit on what other states are doing, or how many other states have done something similar?
There are a few other states that have done something. Louisiana actually just passed something that actually goes even further than what my bill does, that allows for pharmacists to actually prescribe HIV to make it even more accessible. This bill does not do that, so this bill does not go that far.
Okay.
But yes, there are other states that are doing the same thing or even going further.
I appreciate the testimony given today, and I am very supportive of this bill. Thank you.
Thank you, Rep. Rogers. Or anyone else? Okay, I'll read in the cards. Not wishing to speak, supports the bill, Sandy Bennon, GSK. Not wishing to speak, supporting the bill, Eric Roth, Michigan Pharmacists Association. Not wishing to speak, supports the bill, Grand Rapids Pride Center. Not wishing to speak and supports the bill, Scott Ellis, Great Lakes Bay Pride, excuse me. Not wishing to speak, supports the bill, Jessica Crew, Gilead Sciences. Not wishing to speak, supports the bill, Emma Zanotti, Equality Michigan. Not wishing to speak and opposes the bill as written, Carla Roos, Pharmaceutical Care Management Association. Not wishing to speak and opposing the bill as written, Gabe Basso, Blue Cross Blue Shield of Michigan. Not wishing to speak and opposing the bill, but will continue to work with the sponsor, Christine Shearer, Michigan Association of Health Plans. Okay. The last item on our agenda, our testimony only on House Bills 5798, 5799, 5800, and 5801, the money transmitter package. The bills were introduced by Representative Fitzgerald, Zong, Neely, and Cernoglu. Here today to speak on the package is Representative Fitzgerald and Ross Yudnick, the Financial Services Legislative Liaison for the Department of Insurance and Financial Services. You're already here. The floor is yours. Proceed.
Thank you very much, Madam Chair and fellow members of the committee. Yes, I'm here today to discuss House Bills 5798, 5799, 5800, and 5801, otherwise known as the Money Transmission Services Act, which would give DIFs the authority to license and regulate the money transmission services businesses. Money transmitters are financial services companies that receive, hold, and or send money for customers and historically have transferred money across borders and issued money orders and advances. Technology and changes in consumer behavior have exposed unnecessary, outdated, and too often conflicting state requirements across the 50 states and U.S. territories. These outdated and conflicting requirements have made it difficult for regulators to consistently regulate money transmitters across state lines. For companies to operate as a state-licensed state-licensed money transmitters across state lines and to defend the state regulatory system against federal preemption. This act mirrors the Conference of State Bank Supervisors, the CSBS, Model Money Transmission Modernization Act. This act will ensure Michigan is a part of a state-led national effort to modernize, clarify, and unify state laws regarding money transmission services. So you might be asking, what problem does this actually solve? Well, with Michigan adopting the CSBS model law, which other states are adopting, most states that have adopted the model law, there would be consistency with those same states. The benefits of this specific model law really are as follows. The act would provide regulators with the tools needed to regulate money transmitters of all sizes, including those that operate globally or small businesses operating locally, enabling multi-state licensing and ensuring the benefits of multi-state licensing agreements can be expanded and enhanced, creating greater efficiency, and multi-state supervision, ensuring the benefits of the one company, one exam program can be expanded and enhanced. This is the first opportunity to enact the CSBS model law as it was approved really in August of 2021. In totality, this is what these bills accomplish. My bill would create the Money Transmission Modernization Act. Rep. Song's bill 5799 would amend the Consumer Financial Services Act of 1988 to define Bureau as the Department of Insurance and Financial Services. Rep. Neely's bill 5800 would amend the Deferred Presentment Services Transmission Act of 2016, which would revise internal references really related to money transmission services. And finally, Rep. Cerniglu's bill would provide sentencing guidelines for money transmission violations. DIFS has since reviewed the language of the bill and made some specific changes, so there is an H1 sub to that bill. Thank you, Chair Carter, for the opportunity to testify and for listening to this testimony. Members, I know that this is a very dense bill because it is something that came from the CSBS. This is something that was heavily vetted, again, by that coalition of state bank supervisors. With that, I'd like to turn it over to Ross Yednock for the opportunity to testify from DIFS.
Yeah, and I'll be brief. I don't have a whole lot to add, as the representative did a great job covering the bill. But what this will do is it standardizes definitions, eliminates technical differences between states, exemptions from money transmitter licenses to promote consistency among states, and provides that safety and soundness requirement and protects consumers. Already, as of yesterday, when I checked the CSBS website, there were 26 states that have adopted it, so we would be the 27th. And I'm here to answer any questions beyond that, but this is one of the bills that DIFS is happy to be part of.
Thank you very much for both of your testimony. I'm going to open it up to the committee for questions now. Do we have any questions? Yes, Rep. Young.
Gentlemen, thank you. I just want to be clear, we're updating this. When I think of money transmitters, I think of Western Union. That's what we're talking about. Now, this, more recently, it's Cash App and Venmo, and are we talking about those types of entities? Because to me, they're money transmitters too, so I just want to be clear about exactly what we're talking about.
Yes. The original Money Transmission Act, or Money Transmission Services Act in Michigan, was adopted in 2006. And again, a lot has changed since then. When looking through different licensees currently under, you do have Western Union, but you also have Apple Pay, Google Pay, Amazon Pay, the Cash Apps, all of those fall under this.
Okay. Thank you, Rep. Young. Are there any other questions? Rep. Neyer.
I guess what type of regulations and what type of management, staffing and so forth to try and regulate this update, or is it already in place? It would just be a change in procedures.
It's bringing conformance across different states, so it's changing things as far as staffing and levels like that. It doesn't change much. It just brings us in line with the other states.
Thank you. Are there any other questions? All right. Well, thank you both for your testimony. Good bills. Okay. Well, we have a card to read. Not wishing to speak and supports the bill, Tabitha Zinni, Independent Payroll Assessors Association and the Payroll Group. Now, we need a motion to excuse Representative Bazat from today's meeting. Minority Vice Chair Harris moves to excuse Representative Bazat from today's committee meeting. He's on Zoom. Okay. Hearing no objections, Representative Bazat is excused. Now, before I entertain a motion to adjourn, I want to make a quick point of clarity here. We do not anticipate this being our final meeting. The reason why we brought these absolutely delicious Avon donuts in here was because we had a very special guest who was here from Washington, D.C., who just got her postdoctoral certificate. And that's once again is Alexis. You know, one more time, stand up. One more time. She's the reason everyone's getting treated to donuts. But Alexis, there's a young lady over there in a blue kind of like jacket. Her name is Kristen Grant. She was the one I was talking to you about yesterday. So when the meeting ends, you might want to go over and have a little chat with her. Okay? Thank you. So seeing no more business before this committee, we need, now not everybody don't jump up and do it at the same time. We need a motion to adjourn. Representative Rogers moved to adjourn, and hearing no objections, we're adjourned. Don't forget the donuts.